virus, but a big impact. And joining us today is Dr. Nadia Azlisham, who is a consultant pediatrician with UITM Private Specialist Center, which is UPSC. Welcome to the studio, Doctor. How are you today?
I'm good. Good morning, everyone. Thanks, KG, for having me here.
All right. It's an absolute pleasure, Doctor. And Doctor, we start off. Influenza, right? We keep hearing the word, but do we really understand what that word is? And we would like you to explain that to us.
All right, okay. Influenza actually is a very long known virus before COVID. Okay, but then I think people started to forget about it because of the pandemic that we had recently about COVID.
Yeah.
Okay, actually, influenza had a way disastrous compared to COVID last time when the vaccine was not developed yet. Okay, but now the circulating virus that we have, influenza A and B. A H3N2 and B strain B. Okay, actually influenza also has C and D, but not familiarly known. C is just mild symptoms. D actually viruses among cattle, not human.
It's a non-human virus.
Yes, but the circulating, the common ones now are A and B.
A and B,
Yes.
influenza A and B. I think the one that we know the most is influenza A, of course, and B is something slightly different.
Yes, but it is almost causes similar symptoms, but B is more harmful.
B is more harmful. Right, and of course, the cause for concern is because, of course, the situation in Malaysia. So what is the influenza situation in Malaysia right now?
As I think everyone is alert. Everyone is alerted on the news everywhere. Influenza, we are having mass outbreak, especially among school children, daycare centers, because of these children are grouped together doing the same activities and side by side at the displays, causing easily transmitted viruses among the school children. And they are the ones we call as vulnerable
Group.
or high-risk groups, especially those below 5 years old and adults above 65 years old.
All right, so that means we are safe lah. For now.
For now?
I mean, not safe as in we can still get it, but the effects won't be as severe. That's what we mean by high-risk groups.
Because high-risk groups, they are more tendency to be hospitalized with more serious symptoms, more complications, and even leading to death.
Right, so yeah, there's a lot of things that we can talk about right there, especially with the influenza situation in Malaysia. But let's talk about the symptoms and the complications. What is that like?
Okay, I think most of people have known the symptoms, but need to be more alert. Okay, because it's not just a common flu. Okay, it's not common flu or common cough, common colds. Influenza has this characteristic, which is sudden onset of high fever and very weak body ache.
Yeah.
Okay, and cough or flu that is unusual and sometimes leads to breathing difficulty. For younger children, when they have high fever, 39, 40 degree, they can have fit.
Yep.
Yes.
Epilepsy.
We call it as febrile seizure, febrile fit. This is caused by the influenza virus.
All right, because of the temperature being so high and the body is unable to take.
Detrimental to the brain of
Yeah.
a young infant developing toddler.
All right. So that is some symptoms and complications. But can it be confused with other diseases?
Yes, it can, because it portrays quite a similar symptoms. If you ever heard of other viruses that are also common, like RSV, adenovirus, okay, they are about the same. COVID virus, they are actually, these viruses, they have the quite similar symptoms, but the only thing to distinguish between them is having a swab test done. Diagnostic test.
So the outward symptom all looks familiar.
Right.
So
Familiar.
parents cannot just say, this is just normal cough lah, this is just normal fever.
Usually normal cough and flu will just go off within a day or two. And the fever is just low grade, like 37.5 to 38 plus. And it will resolve with just a simple medication, fever medication. And the children will still remain active throughout the day. It's just a bit of flu.
Yeah.
A bit of fever, but running around freely.
Disgusting, but yeah, it's okay. Yeah.
But if influenza, your children will be tired out,
Lethargic.
less, drink less, less active. You can see very different. Even though you give medication, fever medication, the fever still spike further.
Because it is viral, not anything else.
True.
All right. So, okay, doctor, what we're gonna do? We're gonna be taking a small break. We're gonna listen to a song from our era.
All right.
All right. And once we come back, we'll talk about whether vaccines can cause influenza. Because unfortunately, a lot of anti-vaxxers seem to be popping up left and right, especially after COVID. Right.
Yes.
So we'll talk about that once we come back. Don't go anywhere. You are currently listening to TRAXX. This is Health on TRAXX. We're talking about a tiny virus called influenza, but with a big impact, with our guest, Dr. Nadia Azlesham, who's a consultant pediatrician with UITM Private Specialist Centre. Don't go anywhere. We will be right back. Virus big impact with our guest, Dr. Nadia Azlesham, who's a consultant pediatrician with the UITM Private Specialist Centre. Welcome back, Doctor. And now this is a question, right, that I think is very important, especially during this current time frame, because a lot of anti-vaxxers have popped up over the years, especially after COVID. Do you think vaccines are the reasons influenza happens? Can vaccine cause influenza?
Okay. I've got that a lot. A lot of people ask me before. But I'm here to tell everyone, vaccine doesn't cause influenza virus. Okay? Because vaccine, if you are infected with the virus, you can be infected 1 or 2 days earlier. By a person that already got the virus.
Yes.
But you didn't have any symptom at that point of time, and you went for the vaccine. Okay, so after the vaccine, you started to have the symptom. Okay, but you blame the vaccine. It's not because of the vaccine. It's because you were exposed 2 days earlier to a person that already have the virus. It happened that you had the vaccine after that.
Yeah, because right now we don't know where it's coming from, right? Like
Yes,
it
because
could be.
it transmit with 2 methods. One from the airborne means when a person who's already got the virus cough, sneeze, so the respiratory droplets disperse in the air, and then you are just very close to the person, and you got it. Number 2, if a infected person cough or flu, didn't cover. Okay, so the cough, the sneeze, the phlegm, kahak semua here.
Oh, disgusting, but okay, go
Okay,
on.
and then hi KG, pegang you, and then you touch your nose, touch your eyes, and you got the virus.
I should shower more often. But you know, this is the thing, right? It is invisible. Can influenza carriers be asymptomatic?
No,
No, they will exhibit.
they will exhibit symptoms. That's come the vaccine. Okay, vaccine is not 100% protection, but vaccine reduces the severity of the symptoms. If 3 siblings, one already got vaccinated, the other 2 didn't haven't unvaccinated. So, but the 3 are exposed to the virus. Okay, only the 2 unvaccinated will have more severe symptoms compared to the
vaccinated
one.
All right. Okay, that is very much understood, because a lot of people still don't understand that vaccination works well if it's gotten beforehand. It's not a medicine. You don't inject it to cure yourself off. You reduce the severity of the symptoms, especially because viral diseases are just like that, right? You cannot exactly use what's the thing, antibacterial. What was it? Antibiotics.
Antibiotic, yes. Antibiotic works for bacterial infection, but for influenza, because it's virus, so it needs antiviral.
And but for influenza, okay, you know what? We'll go to the next question, and I do have a follow-up question to that. Okay. All right. Can influenza be managed at home, and when does one actually seek help?
Okay. Actually, generally, influenza can be managed at home if only exhibit mild symptoms.
And can you explain what are mild symptoms?
Okay, mild symptom means you have fever, but you still can drink or eat relatively okay, and you don't have the breathing difficulty, or very don't have breathing difficulty, or something that make you feel very weak. Okay, as long as you can walk, you can eat, drink, still having fever, you can rest at home and drink plenty of water. Get yourself tested. If positive, take medication. Okay. You start early. Means you start as early as possible the antiviral medication, and the symptom will go off very fast.
All right. So, okay, this is my follow-up question, right? So when they seek help when it gets severe,
True.
and the treatment is just management, right?
True. Management of the symptoms plus the antiviral medication. The earlier you start, the better it is, the outcome.
Okay. And usually by when, say for instance, you kena today, by when would they exhibit symptoms?
Okay, you cannot, okay, means like I've mentioned earlier, you can be exposed 2 days, 3 days earlier.
So the exhibition period will be 3 days after.
Okay, yes, true.
Okay.
Very clever.
My mathematics today very on point. Okay, we're going to take another short break. By the way, to our listeners out there, if you do have questions, our TikTok is live. We'll have a look at it. If there are questions, we'll be more than happy to answer them. I mean, not we lah, doctor lah. I cannot answer anything for you guys. So if you have questions, do send them to our TikTok page and we'll answer them. And right now we're going to be listening to another song, and once we come back, there's more to talk about, because once we come back, we are going to be talking about, let's see, what can the public do, right? Because this is also our responsibility to make sure the spread of influenza is curbed. So don't go anywhere. We will be right back, right on TRAXX. Consultant pediatrician, she's a consultant pediatrician, UITM Private Specialist Centre. Now, Najib asked the question, what is the percentage of COVID vaccinated people to get influenza A or B? Now, this is a common misconception, right? If you are vaccinated against COVID, then the answer is you're vaccinated against only COVID.
True.
And if for influenza, it's a completely different vaccine. It's not related.
Yes.
Okay. All right. So, Najib, we hope we answered your question. Najib also asked, we have vaccine for influenza now, right?
True.
Yeah. And does that cover A, B?
Definitely, it covers. So actually, vaccine, the composition for the influenza vaccine changes every year. Okay, new vaccines are updated based on the research, which viruses are circulating more commonly. And the new vaccines are updated every year. That's why influenza vaccine we are recommending to be vaccinated annually to give an optimal protection against the virus.
Because the vaccination that you had last year might not work for the virus this year because of the mutations that it usually goes through.
The strains varies.
The strains varies, and all this virus infection is actually quite scary, because sometimes you think you're vaccinated, but then you forget your next vaccination date, and then suddenly you kena, and then like, huh?
Yeah.
And then you realize like, oh, new version. Like back in COVID, we had oh my god, COVID had so many versions, right?
Yeah, true. I think we had four jabs.
Yeah, 4 jabs, and then they had one Transformers kind of mean. What was it? Omicron,
Yes.
Omicron, yeah.
Omicron.
Yeah. All I remember is the Cybertron, all that. But anyways, coming back, since we're already deviating quite far, aren't we? What can the public do to prevent the spread of influenza, doctor?
Okay, number one, it serves the same purpose as in COVID. To prevent further transmission. Means if you are sick, don't go to work.
Yeah.
Quarantine at home.
Don't be gung-ho.
If your children are sick, don't send to daycare or school.
Yeah.
It will spread to other children.
Don't be responsible.
Number 3,
I'm telling what you're thinking right now.
if you are sick, please get help. See doctor. Check by doctor. Get proper treatment. Because and number 4, vaccine, very important, because vaccine is better than cure. Vaccine reduces the severity of symptoms, and vaccines can be taken for children 6 months and older, 2 doses. And then for pregnant lady, any trimester throughout the pregnancy is safe.
It's safe
to be vaccinated for influenza vaccine.
Okay. All right. I have a couple of follow-up questions. One of them is from Najib again. Najib asks, can we get the influenza vaccine at any clinic kesihatan? What's it like over there?
Klinik Kesihatan for senior citizen registered through MySejahtera, it is free.
Okay.
Just like COVID.
Just like COVID. So that only for senior citizens though this time?
Or in KK.
In KK.
But in other private sectors like GP clinics, hospital privates, flu vaccine, influenza vaccines are readily available.
All right. And are influenza swabs available at pharmacies?
Okay. This one is a very hot topic because as in news, I think a lot of pharmacy, retail pharmacies. They are selling this rapid test, swab test,
Okay.
be done at home, and some are not certified.
Oh, direct import.
The result can be misleading.
Okay, so the best option right now, go to a certified clinic and make sure
Yes.
they do the test.
Okay, the proper test and certified test kit.
Okay, so right, certification. Now that is a problem, isn't it? All right, so I guess that brings us to the end of our interview for today, Doctor. Before we end, is there any other information that you would like to share for our listeners?
Okay, influenza is not a common flu. Influenza can be dangerous, especially to the high risk group people. So protect yourself, protect your children. Okay, make safe environment and get vaccinated.
Yep, and don't send your children to school. All right. I understand you want your children to study well, but if they're sick, they're not studying one thing there.
True.
That's for sure, right? All right. Thank you so much, Doctor. We hope to have you again. It's been very fun talking to you.
Thank you so much.
And thank you for making such a complex topic very easy, even for me to understand. All right. And we'll catch you soon.
All right, thank you.
All right. So that was Dr. Nadia Azlisham, consultant pediatrician, UITM Private Specialist Center. Tiny virus, big impact. That's what we spoke about today. Influenza. Alrighty. And if you do have any more questions, please post them to your nearest clinic because influenza is no game. All right. Sometimes the worst case scenario is death.
True.
All right. With that, I'm not going to end with death, but we're going to end with some good music. All right. With that, we'll see you soon.
All right.
This was Health on Track.